What is PoTS? Postural tachycardia syndrome, or PoTS for short, is an abnormality of the autonomic nervous system. Our nervous system controls bodily functions that we don't even have to think about, such as our heart rate, blood pressure, respiration, and digestion. Sadly, for people with PoTS, having a faulty nervous system can present huge challenges and result in a large number of symptoms which may occur at the same time. Individuals with PoTS experience orthostatic intolerance, which means that they mostly experience symptoms when in an upright position. Let's try and explain things more clearly. When a healthy person stands up, to avoid blood dropping down into the limbs and abdominal cavity, blood vessels contract immediately and the heart rate increases slightly to maintain blood supply to the heart and brain. With PoTS, this automatic adjustment to standing does not work correctly, resulting in an excessive rise in heart rate and altered blood flow to the brain, which leads to a lot of debilitating symptoms. So what are the symptoms of PoTS? These can include palpitations, dizziness or lightheadedness, or pre-syncope, fainting or blackouts, often referred to as syncope, chest pain, shortness of breath, shakiness or tremulousness, excessive sweating, gut problems, bladder problems, visual problems, tiredness or weakness, brain fog, headaches, feeling unwell after exercise, and poor sleep. It is essential to note that not everyone with PoTS will experience all of these symptoms. PoTS can cause significant disability and have a hugely detrimental effect on a person's quality of life. Symptoms range from mild to severe, and all people are affected differently. Symptoms are often worse in the morning and can vary hugely from day to day. This makes life unpredictable and difficult to manage at times. While some people are able to manage their symptoms very well, others can become wheelchair users or housebound. It can be a challenge to understand the range and complexity of this condition. The majority of people with PoTS also have other related medical conditions as well, such as hypermobile Ehlers-Danlos syndrome, allergies, long COVID, and ME/CFS, all of which can make symptoms worse.
We will now learn more from Dr Lim about the diagnostic criteria for PoTS.
But for us as clinicians, we like to see, to make a diagnosis, that your heart rate increases by more than 30 beats per minute when you stand up from a seated or lying position, and it stays sustained for more than 10 minutes at 30 beats per minute higher than it was at baseline. That's criteria 1. Criteria 2 is that your blood pressure does not fall when you stand up. Criteria 3 is you have to have the typical symptoms of PoTS when you stand up, which are shortness of breath, palpitations, lightheadedness. Some people get chest pain, dizzy, brain fog, fatigue. Criteria number 4, which is not very well known about, is that you have had to have these symptoms as a patient for a period of 3 to 6 months, almost on a daily basis whenever you stand up. So if you've only had a viral illness for 2 weeks and you had these symptoms and they resolve after a while, you don't have PoTS. And that is what PoTS means.
Okay, thank you. And for children, is the criteria different?
Yeah, so for children, arbitrarily, there is the difference in criteria 1, which is when you stand a child up or a teenager up, the heart rate rise is more than 40 beats per minute, but all the other criteria are the same.
For more information, please visit www.potsuk.org.